Hi, welcome to MBBS Online Lecture 2021. The topic for today's lecture is about rickets and osteomalacia. Rickets and osteomalacia is a condition that is arise due to the deficiency of vitamin D. We have previously discussed how vitamin D is metabolized in the body, what are the functions of the vitamin D, and what are the deficiencies. If the deficiency of vitamin D occurs, what are the clinical conditions? So we are today discussing those clinical conditions. These are rickets and osteomalacia. Let's discuss it. First of all, the objective for today's lecture is about the vitamin D review. We would review little bit of briefly about the vitamin D, rickets, and osteomalacia. So first of all, the metabolism of vitamin D. As you can see here in this figure, it is well described. Vitamin D, the major source for vitamin D is the sun that converts the 70 hydrocholesterol that is present in the skin to the vitamin D3, or we call other names of vitamin D3 are cholecalciferol, calcitriol. That vitamin D3 is metabolized in the liver by the enzyme that is called 25 hydroxylase that converts it into the 25 hydroxy vitamin D that again travels to the kidney that converts 725 hydroxy vitamin D to the 10 hydro through the 10th hydroxylase enzyme present in the kidney. It converts into the 1,2,5 dihydroxy vitamin D3. We call it DHCC, calcitriol, cholecalcitriol. Okay. So after the activation in the liver and the kidney, vitamin D, active form of vitamin D has three functions, has three main target organs. Those are the gut, GIT, the bone, and the kidneys. So we would discuss briefly about what active form of vitamin D does to these three organs. Secondary role for the vitamin D is such as it activates other hormones such as estrogen, corticosteroids, thyroxine. As previously in the vitamin D, we have discussed that vitamin D is not a cofactor; it is a hormone. So these are the deficiency for the vitamin D. First condition is rickets. First of all, the introduction for the rickets, basically it is a condition arise due to the deficiency of vitamin D in children. So normal bone growth and mineralization require adequate availability of calcium and phosphate. Since calcium and phosphate are the main inorganic compounds that are required for normal growth and mineralization of the bone. Deficiency of these minerals can cause rickets in children or osteomalacia in adults. Rickets refer to the changes caused by deficient mineralization at the growth plate, that is the epiphyseal plate. The osteomalacia refers to impaired mineralization of the bone matrix. Okay, rickets and osteomalacia usually occur together as long as the growth plates are open. Only osteomalacia occurs after the growth plates have been fused. This is because rickets occur in growing child and it's the main characteristic for the children. So mineralization of the bone does not occur at the growth plate. This is called the epiphyseal plate. But in osteomalacia, which is a condition in the adults, it is a less deficiency or less mineralization of the bone in the matrix. So this is the difference between the osteomalacia and rickets. So causes of rickets, first of all, the vitamin D disorder. That could be the nutritional vitamin D deficiency of vitamin D in your natural diet, congenital vitamin D deficiency. The body is not able to produce vitamin D congenitally, means it's present, may be present at the birth. Secondary vitamin D deficiency, such as malabsorption in the GIT, increased degradation, breakdown of the vitamin D by the liver, increases or decreased liver to 25 hydroxylase enzyme. So since 25 hydroxylase enzyme, we have discussed that it converts vitamin D into active form. So deficiency of this vitamin in the liver can cause impaired vitamin D or indica and deficiency of vitamin D. Then calcium deficiency. Since with the vitamin D we need also calcium in the phosphorus. Since these are the two minerals that are mainly involved in mineralization of the bone. So causes of rickets, first of all the renal losses, means vitamin D is hereditary or non-hereditary loss from the kidney due to any kidney malformations or any kidney disease, kidney failure. Distal renal tubular acidosis can cause rickets. So what are the clinical features for the rickets? General failure to thrive, listlessness, protruding abdomen, muscle weakness, especially proximal, and fractures, easily fractures. Head, that is a craniotabs, frontal bossing, delayed frontal closure, delayed dentition caries, craniosynostosis. So chest is rachitic rosary, Harrison groove, respiratory infections, and atelectasis. Atelectasis is a collapsing of alveoli. So back is the spondylosis, kyphosis, and lordosis. There at extremities, enlargement of the wrist and ankles, valgus or varus deformities, wind swept deformity, and other deformities. Hypocalcemic symptoms such as tetany, seizures, stridor due to laryngeal spasm. Some extraskeletal findings in rickets, such as extraskeletal manifestation of rickets, vary depending upon the mineral deficiency. Hypoplasia of the dental enamel is typical for hypocalcemic rickets. Since calcium is also needed for our bones, so sorry, so calcium is also needed for the mineralization of our teeth. So deficiency of the calcium can cause hypoplasia of the dental enamel, where abscess of the teeth occur more often in the phosphogenic rickets. Hypocalcemic seizures, decreased muscle tone leading to delayed motor milestones, recurrent infections, increased sweating. So these were the clinical features. So here you can see in this picture that how the clinical manifestation or the symptoms and complications of the rickets occur, such as odd-shaped skull with frontal bossing, stunted growth, there is a delayed closure since there is a frontanel, we call it. So there is a delayed frontanel closure, spine deformities, odd-shaped ribs, pigeon chest, wide elbow joints, wide wrist joints, wide knee joints, wide ankle joints. These are the clinical manifestation and the symptoms of the rickets. Here you can see the picture of the child with the rickets. Another child. Here you can see all the manifestations and the features. So these are the detailed X-ray for rickets. Here you can see wide gap between the joints. There is a wide gap. This is due to the rickets. So how we can diagnose rickets, such as first of all is the serum phosphorus. If it is normal, we would check parathyroid heart. Here is the diagnostic scheme for the rickets, such as first of all we would see the serum phosphorus. If it is normal, then we would see the parathyroid PTH hormone. If it is normal, this is not due to disorder in calcium or phosphorus metabolism. So it is not caused by any calcium or phosphorus. If PTH is high, hypocalcemic rickets. We would term it hypocalcemic rickets. If serum phosphorus is low, we would check again parathyroid hormone. If it is normal, we would say hypophosphatic rickets, or if it is high, we say hypocalcemic rickets. So what are the biochemical findings in the rickets? First of all, the vitamin D deficiency. It is due to vitamin D deficiency, calcium is low, phosphate is low, alkaline phosphatase is high. So we would see the alkaline phosphatase is increased, PTH increased, 25 active form of the vitamin is decreased, and urine calcium is also decreased. These are the biochemical findings. So we have discussed this. Treatment for the rickets, first of all, the therapy with the vitamin D that should be 3 lakh to 6 lakh international unit orally or intramuscular. Higher dose of vitamin D, 2,000 to 5,000 international unit orally for 4 to 6 weeks. Adequate dietary calcium and phosphorus provided by milk, formula, and other dairy products, or we can use calcium supplements along with the vitamin D. These are the treatment for the rickets. Now let's discuss osteomalacia. What is osteomalacia? The introduction. It is caused by vitamin D deficiency, which is in adults. Defective calcification of osteoid matrix characteristics, as we have discussed previously. The defective calcification in the epiphyseal or the growth plate, we termed it as rickets, while the defective calcification in osteoid matrix, we termed it as osteomalacia. Diffuse radiolucency, which can mimic osteoporosis, is characteristic radiographically. When secondary to renal disease, osteomalacia is called renal osteodystrophy. Mean the calcium is being lost through the kidneys into the urine, that causes less mineralization. We term it renal osteodystrophy. Now it's quiz time. We have finished our lecture.
Can you identify this picture? The X-ray of a child. See if it's normal or a one with the rickets. So it's an X-ray with rickets. So that was the end of the lecture. If you like this video, share it with your friends and subscribe the channel. Like our Facebook page so that you can keep up-to-date information for our upcoming lectures and videos. We have also been working on our website, that is www.mbbsonlinelecture.weebly.com. On there you can get many of the lecture that will help in your studies.